Vasopressin blank. Urine production. A. Decreases. B. Intensify. C. Increases. D. Stops. A patient using hydrochlorothiazide is told to eat more potassium in her diet. The best treat for a patient who needs more potassium is A. Apple. B. Avocado. C. Pear. D. Orange. The inappropriate rise in growth hormones is the cause of and. Please select two correct answers. A. Gigantism. B. Dwarfism. C. Blindness. D. All of the above. Due to the maturity of WBCs in children aid in the battle against infection. A. Oxytocin. B. Thymosin. C. Nemoacid. D. None of the above. For the thyroid hormone to work effectively is required A. Calcium. B. Iodine. C. Vitamin. D. None of the above. A normal blood sugar range is 80 to 180. False or true? A. True. B. False. What exactly are gonads? A. Sexual hormones. B. Testis and ovaries. C. Adrenal glands. D. Thyroid glands. Your body's levels are controlled by the parathyroid. A. Vitamin. B. Iodine. C. Calcium. D. Blood sugar. Which glands control hormone levels by negative feedback? A. Pituitary. B. Hypothalamus. C. Both A and C. D. Adrenal gland. During uterine contractions, moms create the hormone, which causes nursing mothers to expel milk. A. Angiotensin. B. Minotocin. C. Oxytocin. D. None of the above. A patient's primary care cannot be assumed by a registered vocational nurse. A. With bipolar disorder. B. In the fourth stage of labor. C. 2 days post-appendectomy. D. With a venous access device. A patient with persistent dyspepsia who was admitted to the hospital is found to have gastric cancer. Which of the following is linked to a higher incidence of stomach cancer? A. Carbonated beverages. B. Refined sugars. C. Luncheon meats. D. Dairy products. After being accused of setting a fire, a patient is sent to the psychiatric ward for a forensic assessment. The antisocial personality disorder is his preliminary diagnosis. The nurse would anticipate discovering after looking through the client's file. A. A history of cruelty to animals. B. An expression of remorse for his actions. C. A history of consistent employment. D. A below-average intelligence. Which hormone is created when you're dehydrated? A. Renin. B. ADH. C. Oxytocin. D. Thymosin. You are the LPN caring for adult medical and surgical patients on 2 East. Because there is a fire on 1 East, your unit has been told to evacuate your patients horizontally. Where are you going to transport your patients? A. 2 West. B. 3 West. C. 3 East. D. 1 West. What condition slows down metabolic rate? A. Chronic obstructive pulmonary disease. B. Cardiac failure. C. Hypothyroidism. D. Cancer. What symptoms and indicators are present in hypothyroidism? A. Fatigue. B. Depression. C. Both answers. Which pulse needs to be felt when a baby is in cardiac arrest in order to assess cardiac function? A. Radial. B. Carotid. C. Pedal. D. Brachial. Which treatment is most effective for treating constipation while pregnant? A. Taking a mild over-the-counter laxative. B. Increasing the consumption of fruits and vegetables. C. Reduction of iron intake by half or more. D. Lying flat on back when sleeping. The development of gallbladder stones. A. Cholelithiasis. B. Hepatomegaly. C. Hematemesis. D. Cholecystectomy. The task of developing a behavioral management care plan for a patient with dementia is given to the nurse. To lessen the patient's uncertainty and disorientation, the nurse aims to establish reality-orienting tactics. Which of the following treatment strategies will lessen the patient's confusion? A. Using real-time information. B. Cooking the patient's favorite foods. C. Labeling objects. D. Mentioning names of people frequently. A tiny drop of perspiration fell onto one of the scalpels as the operation was being performed. Which of the following would be the best course of action in this case? A. Wipe the scalpel with a sanitized gauze before using it to the patient. B. Set it apart from the other instruments and use another scalpel for the procedure. C. Disinfect the scalpel using chlorhexidine and dry it before using. D. Immediately dispose the scalpel and use a sealed one. An immobilized patient is being cared for by a nurse. How can nurses prevent self-injury when caring for immobile patients? A. Keep a safe distance between the patient and nurse when moving the immobile patient. B. Avoid bending over, leaning, and stretching when working with the patient. C. Keep their feet shoulder-width apart and in a straight line to maintain a proper stance. D. Put the patient at a comfortable height, which is usually at shoulder level. What one of the following is not a contributing cause to wound dehiscence? A. Diabetes. B. Allergic reaction to sutures. C. Infection at the surgical site. D. Unhealthy tissue. An infant who was delivered at 41 weeks gestation is being examined by a nurse. Which of the following traits would suggest that the baby is post-term? A. Flat areola without breast buds. B. Heels movable fully to the ears. C. Leathery skin. D. Excess body fat. Licensed practical nurse. Licensed practical nurses provide healthcare services to patients in a variety of settings. Their work involves taking vitals, administering medication, and assisting doctors with the overall care of their patients. They can work in hospitals, nursing homes, assisted living facilities, and doctors' offices. Some also help with home health services and dialysis centers. Licensed practical nurses are in demand across the healthcare industry. They provide routine care, observe patients' health, assist doctors and registered nurses, and communicate with patients and their families. Whether you're just starting out in the LPN career or are looking for a new career path, a job as an LPN can be rewarding and satisfying. The United States Bureau of Labor Statistics projects that there will be 819,660 LPNs working in 2024.